So moving on to psychological distress, the last main topic. So sometimes, even with great coping skills and great social support, you're going to feel upset or worried at times. And so one of the things I want to touch on here is how can you distinguish between those normal fluctuations in mood and diagnosable depression or anxiety. So for depression, on this slide are some of the key symptoms of depression. For all of these, there's this 2-week window, so it has to be over a period of 2 weeks. And these top two are highlighted because technically, in order to qualify for a diagnosis of depression, someone would need to endorse one or the other, at least, of these top two. And so the first one here is depressed mood most of the day, nearly every day, and remember that means for at least 2 weeks. And so, and I think that the at least 2 weeks piece is also helpful. Because again, you know, we all feel down sometimes. We use the word depression all the time in daily life, right? You know, oh, I'm a little depressed today. And I want to give people permission to go there sometimes and to allow yourself to feel that. But where's the threshold that when you cross the threshold to where you're concerned? Certainly if you hit the point where it's depressed mood for most of the day, nearly every day, for at least 2 weeks, yeah, that sounds like maybe you're getting stuck and that you might need some help to get out of that. The other key one up there, diminished interest or pleasure in activities, especially in the context of a chronic health condition, we need to distinguish that from activities that have changed due to changes in your health. So for example, if you used to love mountain biking, you don't enjoy mountain biking now because you physically can't do it, that's not a symptom of depression. It's your physical health that's interfering with your ability to do the activity. But something like, you know, a movie that used to always would have made you laugh and you just don't feel the humor, you just can't feel that anymore, there's a key symptom of depression. Moving on to anxiety, these top two, again, are like key hallmark symptoms. So excessive anxiety or worry about a variety of events and situations for more days than not for at least 6 months. So again, there's that sense of really in a rut. You know, more days than not for at least 6 months. That's kind of a high burden load. And then difficulty controlling the anxiety, which is a little bit hard to define. But I think of controlling the emotions as basically, are you able to shift gears? Are you able to kind of put the anxiety or the worry on the back burner? Or if you are having difficulty controlling the anxiety, how that might look is that it's interfering with your ability to fall asleep at night because you just can't shut your mind off, or interfering with your ability to focus on paying bills or doing your jobs or really being engaged in relationships. So when in doubt, treatment is always an option. So, you know, you're allowed to have your daily ups and downs, but if you think that you might have symptoms that indicate a need for treatment, certainly seek evaluation or treatment. I think I've already hit on all this. But the idea you can go there, just don't park there. A key question is, does it seem like you're stuck, that you're not just going there, but you got stuck? And really this other interference piece is key as well. If you feel like those emotions of depression, symptoms of depression or anxiety are interfering with your ability to engage in your life, whether it's a paid job, social activities, key relationships, that's a real indicator that it may indeed be worth seeking further evaluation and treatment. In terms of treating depression and anxiety, medications are highly effective. Psychotherapy is highly effective. Psychotherapy is the fancy speak for talk therapy. On average, for moderate or mild depression or anxiety, medications and psychotherapy tend to be equally effective. Once it gets severe, for severe depression or anxiety, medication does tend to be more effective. And the most effective approach is to hit it with both, to do both medication and talk therapy. Medication will typically have quicker results, but the talk therapy is more effective at relapse over time because you're learning skills and techniques that you can use in the future. For treatment resources, you can talk with your physician, contact your health insurance company, and on this slide I have a bunch of websites or phone numbers. What I'm going to do is I'll keep going, but maybe during the question and answer I can toggle back to this and put the slide back up in case people want to write anything down. In terms of finding a therapist, my personal recommendation is that you don't need to get too stuck on the exact credentials. There are licensed psychologists, licensed clinical social workers, licensed marriage and family therapists. I don't think that one profession is across the board better than another, but you probably do want someone who is licensed and someone who has experience working with individuals or families around chronic health conditions. And another key question is, do you feel comfortable with this person? If you meet with somebody 2-3 times and you really just don't feel comfortable in your gut for whatever reason, I want you to have full permission to find a different therapist. Not every therapist is the right fit for you. Not all therapy is the same. A couple key different types of therapy is couple family therapy may be ideal if your challenges are in your relationship dynamics due to any changes in your relationships due to the illness or concerns about burdening your family. Maybe you want to find a therapist who specializes in working with couples or families. A totally different option is cognitive behavior therapy, or CBT for short. There's a lot of research supporting the utility of CBT for depression and anxiety. And CBT is time limited and really structured. And so if you did choose to try CBT, it's not like meeting with a therapist twice a week for the rest of your life. You go in there, you do the program, you learn your skills, and you move on. There are a lot of self-help books based on cognitive behavior therapy, which may be a useful way to kind of dip your foot in the pool of seeing what CBT is like before you would find a therapist to work with. I'll toggle back to this slide again during the questions as well. And this is really my last slide, is the super basic plan, which is to continually work toward that goal of living well and enjoying life even with a chronic health condition. So intentionally using coping skills, experimenting with learning new coping skills, allowing yourself to use your social support system, that it's okay to let other people help you, and monitor for depression and anxiety. It's okay to have a bad day, but if it's more than just a bad day and you feel like you're really getting stuck, or that symptoms of depression or anxiety are interfering with your ability to engage in your life, seek evaluation or treatment, because treatment is very effective for depression and anxiety. And I just want to acknowledge that I'm preaching to the choir in some ways. You know, signing up and doing this webinar is an example and evidence of a good coping skill right there. So, and thank you to all of you for listening.